Hello, everyone. Good afternoon. Welcome to Project First Line's Injection Safety Refresher Training. This is our very first lunch session offering, so it's very exciting. On behalf of Project First Line Rhode Island, thank you all for what you do for our community. My name is Karina Descartes. I'm the Project First Line Rhode Island team lead, and it's my great pleasure to host this training for you today. We have a great session prepared for you this afternoon. But before I invite our trainer and subject matter expert to introduce themselves today, for those of you in the audience who would want to, I'd like to direct your attention to the chat box and invite you to introduce yourselves. You can type your name, what your role is in your organization, if you're comfortable, and where you're coming from in Rhode Island or elsewhere as you join us today. And while you're doing that, I'd like to also welcome other members of our team who are also here in support of this webinar. Abby Anderson, our colleague, is our wizard behind the scenes, and she will be connecting with you all on chat. Now I'd like to invite Dr. Alexis Kearney and Ms. Allison Thurber to introduce themselves.
Hi, everyone. My name is Alexis Kearney. I'm an emergency medicine physician and a consultant medical director here at Rhode Island Department of Health, working on Project First Line. And I am so excited to be here with all of you today.
And hi, everyone. My name is Allison Thurber. I'm a nurse in the Center for Acute Infectious Disease and Epidemiology at the Rhode Island Department of Health, and I will be your infection prevention liaison for this refresher training session.
Thank you so much. And for those of you who are just signing in, I can still see some people logging in. Welcome. You are in the injection safety training by Project First Line Rhode Island. This is our agenda for this afternoon. We have done our introductions. And for this refresher, we'll begin by reviewing the difference between single dose and multi-dose vials, the importance of infection control when using multi-dose vials, and then we will review each of the safety steps for using multi-dose vials. And then we'll have some time for discussion and answer questions you may have for us this afternoon. And then we'll share more information on how to connect with Project First Line Rhode Island Infection Prevention Learning Community that we have been co-building with our various partners. And before we conclude today's session, we'll request for a quick feedback vote from you to help us improve on our future sessions. And these are our partners in support of today's session. And before we formally begin, some very useful reminders. Everyone is muted at this point except the training team. If you look at the bottom bar of your Zoom app, you will see three things: Q&A box, a chat box, and a hand raise icon. For the Q&A and discussion at the end of this session, please use the Q&A box to send your questions or use the hand raise button to be unmuted. If you have any questions about what is being discussed at any point, please feel free to type them in the Q&A box and we will fill them for a Q&A as mentioned later in the session. Please use the chat box to type your email if you wish to be included in our email list for updates or just to say hello. Today's session is being recorded and we'll send an email update once it is ready for release. Again, welcome everybody. And without much further ado, Ali will now begin.
Hi, everyone. Again, my name is Ali, and I will be your trainer for this refresher session. So first, we're just going to start with a few learning objectives for this course. So in the end of this course, we hope that you understand the difference between single-dose vials and multi-dose vials. We hope that you can at least discuss two reasons why injection safety actions are important when using multi-dose vials. And in the end, we are going to go over many steps, but hope that we can remember at least 4 injection safety steps to take when using a multi-dose vial. All right, so let's define a single dose vial. So a single dose or single use vial of liquid medication is intended for parenteral administration. So that would be not by mouth, either injection or infusion, and is meant for a single patient, case, procedure, or injection. They're usually labeled as such. So if you have a multi-dose vial, it'll say multi-dose vial and there'll be a place for labeling. And if you have a single dose vial, it will differentiate that it is a single dose vial and should be discarded after one use. So there are many steps to injection safety and single dose and multi-dose vial safety. We'll go over a lot of them in this session, but we have highlighted a few important single dose vial safety tips. So first thing is that single dose vials are labeled for one-time use. You'll hear this over and again throughout this session, but if it's a single dose vial, it will be labeled as single dose. And if it's a multi-dose vial, it will be labeled as multi-dose. Single dose vials are to be accessed one time and only one time by only one patient. So if you have a procedure and you have to access that vial multiple times, you should be using one vial each time, because again, the needle should only be going in once. That's the whole purpose of the single dose vial. Do not pool leftover contents. So pooling, in other words, is using multiple vials for one dose. Because a single-use vial should really only be used once for one dose, we shouldn't have any leftovers. We shouldn't be saving it for later. There should be no pooling of doses to make a full dose. And lastly, discard when sterility is compromised. So anytime with any medication that you think that medication is compromised, although we don't want to waste, we don't want to put our patient's health at risk. So make sure that you're discarding the vial if you think that it was discarded in any way, if it's past expiration, if it looks a certain way and maybe you don't remember it looking that way before, you can always consult with pharmacy, but make sure in the end you're discarding it if it's not what it should be. So that brings us to multi-dose vials. So what is a multi-dose vial? A multi-dose vial is, just as it sounds, is a vial of liquid medication intended for parenteral administration, either injection or infusion, not by mouth, that contains more than one dose of medication. So multi-dose vials should be clearly labeled by the manufacturer. There should be a place on it for you to label date, time, and initials when you open or first access that vial. So multi-dose vials are typically vaccines, is what we mostly see, at least in my practice that I know of. About 6 or 7 years ago, I worked at a per diem as a nurse in a long-term care hospital. And I do remember that we used insulin as multi-dose vials. So we would have a floor stock of insulin. Outside of that, in the ER or on inpatient floors, I don't recall much aside from vaccines that we would keep as multi-dose vials. So I'm interested in seeing in your clinical practice if you use multi-dose vials on a regular basis. Maybe you work in a pain management clinic and steroids are in multi-dose vials, or perhaps dental or podiatry and you use lidocaine in a multi-dose vial. So if you don't mind putting what type of clinic or facility that you work in and what kind of medication you use in multi-dose vials in the chat box, it would be nice to kind of just get an idea of what we're all working with. So because multi-dose vials are different from single-dose vials, they require other important safety injection considerations than single-dose vials. We are going to go over step by step, but we've just highlighted some quick tips ahead of time. So first, multi-dose vials pose more contamination risk. Why? Because they're being accessed multiple times. So you are putting a needle in multiple times, so you have contamination potentially on the needle, on the syringe, on the top of the vial, on your hands that could get into the vial. So there is more chance for contamination risk, which is why with multi-dose vials, we have extra steps. On that note, a clean syringe and needle needs to be used every single time. So even if you don't see, blood pulled back in a vial, it can still be there. We know that there's germs we don't see. We know that there's contamination risks that we don't see. And you don't want to risk spreading a bloodborne pathogen like HIV or hepatitis C, hepatitis B. So clean needle and clean syringe every single time you draw and inject. And then lastly, do not use vials you suspect are contaminated. And again, we've already said this and we've been into this about 5 minutes. But most importantly, if you take anything from this session, if you suspect that a vial is contaminated, tampered with in any way, doesn't appear the way it should, throw it out. We don't want to be wasteful, but we don't want to potentially harm our patients. So next, we're going to watch a quick little 3-minute video from CDC, which outlines some important multi-dose vial safety steps. And then after that, we will go into each step in depth.
Many vaccines, including the current vaccines for COVID-19, come in small bottles with more than one dose of vaccine inside of them. These multi-dose vials are accessed multiple times to vaccinate multiple people with a fresh needle and fresh syringe every time. Using multi-dose vials safely helps ensure they don't become dirty and possibly harm people. That's why it's really important to follow injection safety steps and instructions from the vaccine maker when using a multi-dose vial. Here are 10 injection safety steps to remember when working with multi-dose vaccine vials. However, depending on the vaccine maker may recommend additional steps, so be sure to check before starting. Step 1. Always prepare multi-dose vial injections away from patient care spaces in a designated clean area. Preparing multi-dose vials in a separate space helps ensure they are handled correctly and decreases the chance for mistakes. Step 2. Clean your hands before you touch the vial so that you don't get germs from your hands onto the vial, because they could get inside the vial and contaminate the vaccine. Step 3. Check the label to make sure it is a multi-dose vaccine vial. If it's not, the vial should only be used once for a single patient. Next, confirm the vaccine is not expired. Expired vaccines may not work as well and should not be used. Step 4. Look and see if the vaccine appears the way the maker of the vaccine tells you it should. If it doesn't, or you're worried something has gotten inside the vial and made it dirty, don't use it. It could be contaminated. Step 5. Use a brand new sterile needle and brand new sterile syringe for every vaccine dose. Just using a new needle is not enough. You must use a new needle and new syringe, because if the syringe is dirty or has been used, blood can get into the vial when you draw up the vaccine, even if it looks clean, risking the spread of viruses like hepatitis C or HIV. Step 6. Disinfect the top part of the vial stopper, with an alcohol prep pad every time. There are a lot of germs on the top of the vial. If it's not clean, then when you insert the needle into the vial, germs can get pushed into the vial, contaminating it so the vaccine inside can't be used. If it is used, those germs could be injected into patients and make them sick. Step 7. Let the top dry before sticking the needle in. This gives the alcohol time to kill any germs that may be on top of the vial. Step 8. The first time you put the needle in the vial, write the date and time it was opened on the label to help prevent the vaccine from being given to a patient beyond its use date. Step 9. Follow the vaccine maker's instructions for storage and for how long you can use the vaccine after you first access the vial, which varies by product. Beyond use or improperly stored vials must be thrown away. Step 10. Never pool doses. Combining partial doses from multiple vials to make one dose for a patient can increase the risk of germs or other stuff getting into the vaccine, which can make people sick. By following injection safety steps and vaccine maker instructions every time, you will help keep yourself, your colleagues, and your patients safe.
Great. Okay. So now that we have reviewed that video of the steps, we're going to go through each step one by one, break it down. I urge you, if you have any questions, to please put them in the Q&A box, and then we'll answer them at the end of the session. We have some time designated for Q&A and chat. The video did give me some time to look through the chat and just see where we have, where everyone's from. So it looks like we have some hospice, some psych, dental, home care, RIDO, some professors, adjunct faculty, and some community programs. So it's great to see the different types of clinicians we have here. And I did see that we had some answers of people saying that they use insulin as multi-dose vials, vaccines, and PPD testing. So again, if there's anything that we did not list that you want to share in your clinical practice that uses a multi-dose vial, go ahead, because I think it would be great and informative for everyone else in different specialties. So we'll start with our first step. So first step we went over is always prepare multi-dose vial injections away from the patient care spaces in designated clean areas. A few reasons for this. You want to make sure that you're distraction-free when you're drawing up medication from a vial. You also want to make sure that you're not contaminating that vial. So if you draw it up in a patient room or patient areas, you're more at risk to be distracted. You're more at risk to contaminate that vial from something that's in the room, who knows what. So First step. Next step is to clean your hands before touching the vial. So before we have any sort of patient care, we want to make sure that we have done our hand hygiene, but prior to doing any sort of administration of medication and touching that vial, touching that sterile syringe and needle, make sure your hands are clean so that anything from your hands is not getting into that vial, into that syringe, into that needle. Step number 3, check the label to make sure it is a multi-dose vial. So again, just like the picture, we should see clear labeling of multi-dose vials. If it's unclear in any way, you can check with the pharmacy, but there should be an expiration date that should say multi-dose vial, and then there should be a space for you to label a multi-dose vial. Next, you want to check to make sure the medication is not expired or beyond use. So expiration date is just the generic expiration date for the medication in general. But then the beyond use date is going to come from labeling the first date that you access. So when you first open that vial and when you first pop that cap, you want to label it with your initials usually, but it's usually facility-based, and then the time and date that you opened it. Most vaccines and multi-dose vials are good for about 28 days, but you want to make sure you follow the manufacturer's instructions for multi-dose vials for when it is beyond use. Next, you want to make sure that the medication appears as it should be. So if it's a medication that you typically use in the past, say it's a COVID vaccine and you've been giving COVID vaccines all the time, and you look at it and it appears cloudy, and you've noticed every time you've given it in the past, it was clear, then you may want to consider calling pharmacy or speaking with somebody else who may know what the vaccine looks like. If you can't figure that out, check medication manuals. Worst case scenario, throw out the vaccine. You do not want to be using something that is potentially contaminated. Step number 6, make sure you're using a brand new needle and syringe each time. I know we've kind of exhausted it throughout this session, but even though you can't see it sometimes, you don't want to be spreading any bloodborne pathogens or any sort of germs from a reused syringe or reused needle. Step number 7, disinfect the top part of the vial stopper with an alcohol prep pad every time. So this includes when you first pop that cap. CDC has some great resources on injection safety, and they make it a point that the top of the cap is not sterile. So when you pop that cap, make sure you're cleaning with an alcohol pad, and then every time in between when you're accessing a multi-dose vial, you want to make sure it's freshly cleaned. Part of alcohol pads actually doing their job is by allowing dry time. So let the top dry before you stick that needle in, and that'll allow for the alcohol to actually kill any sort of germs or contamination that's on the top of the vial before you access it. Step number 9, document the first time the vial was accessed by writing date and time on the label. So the multi-dose vial, again, you would write the date and time that you first used it, along with your initials. If for some reason it's not labeled and you see that it has been accessed before, you should not use it because you don't know if it's past its beyond use date. Step number 10, follow medication instructions for storage, whether that be shelf life where it doesn't have to be refrigerated, whether it needs to be frozen, whether it needs to be refrigerated. Make sure that you follow those instructions, otherwise it may make it less effective. And step number 11, never pool doses. So again, pooling doses is combining multiple doses for a single patient from multiple vials. And we should be getting one dose from one vial, even if we're using multi-dose vials. So Abby is going to put in our chat the link to this, I think, very useful poster handout resource. CDC has some great resources for multi-dose vials, vaccine safety, injection safety, and this is just one of them. So it's a poster you can print out. You can give it to staff, use it in your office, just use it just to remind you before you give a multi-dose vial if you need a quick reminder. It lists out all the steps we just went over quickly, easily. It's a good resource. And then we are going to go to some poll questions. So I think we have a series of 4 poll questions just to kind of review and reinforce what we've learned in this session. So if you've never used poll questions in the past, a question is going to pop up on the screen. You just go through, select your answer. It doesn't show who says what answer. It just gives us a percentage at the end, and then we'll go over the result. So first poll question is true or false. Actually, all true or false. It is acceptable to prepare a multi-dose vial medication in a patient room as long as the vial never touches the patient. Is that true or false? All right, so it looks like 93% answered false, which is the correct answer. So preparing multi-dose vials, it is best practice to draw it up in an area away from a patient room. So you decrease the risk of contamination for other patients that may be getting that vaccination or medication from that vial. And it also just helps to eliminate distractions. It is acceptable to combine several multi-dose vials to make up one dose for a patient. Okay, so this answer again is false. We do not recommend combining multi-dose vials to make up one dose. That's called pooling. And we recommend taking one dose from one vial. If a multi-dose vial has been accessed but is not labeled with a date, it is recommended to waste the contents of the vial and throw it out. Okay, so 100%, this one's true. It is recommended to throw out the contents if it has been accessed but not labeled. You don't know what that use by date is, and it could no longer be effective. And last question. The same syringe can be used for multiple patients as long as the needle is sterile and changed every time. All right, looks like most answered false, which is correct. The same syringe cannot be used for multiple patients. It is recommended and best practice to avoid contamination that you use a new syringe and new needle every single time. So aside from this course, CDC, as I've mentioned before, has some really great resources for yourself, for your staff, just as reminders or to hang up in an office or to just catch up on some continuing education. They have developed one needle, one syringe, only one time campaign to help prevent needle contamination and the health risks that are involved. So we are going to provide this link with the post-session resources for the one needle, one syringe, only one time campaign. Sorry, it's a little tongue twister. But they have some great videos, handouts, if you ever need a resource or just need to refresh up on your injection safety. And lastly, we will just go through some key takeaways from this course. So first off, injection safety actions are important. Secondly, multi-dose vials require a specific set of safety procedures that are different from those of single-dose vials. And why is that? Because multi-dose vials pose more contamination risk. That being because they are accessed multiple times, so there's more risk of contamination each time you access that vial. And lastly, and I would say very most importantly, contaminated vaccines and medications cannot be used. So if you suspect or if you know that a vaccine or medication is contaminated, make sure you're wasting that appropriately and throwing it out.
Thank you so much, Ali. Your certificates of training will be emailed in PDF after the post-session survey closes next week. And as a reminder, it closes midnight on July 18th, Monday. Post-session survey will arrive in your emails tomorrow, and PowerPoint, post-training materials, and links to resources will be emailed as well. We're very excited to get to your questions soon. I see a couple of questions coming in. Let's see. So if you want to be included in our updates, again, via email, and you have not already, feel free to type your emails in the chat box or send us an email directly. Our email is found in the first link up there in your screen right now. And when you receive the PowerPoint, you will see these links as well. And we'd love to hear from you, from each one of you. And please reach out to our team directly via that same email. And our website is right here. And you can also get updates from us from these social media sites. These are our references. And before we go dive into our Q&A, we have an upcoming refresher on transmission-based precautions for mobile care teams. So if you or your colleagues are part of a dental team, optometry team, or podiatry team who go to skilled nursing facilities and assisted living facilities to care for our patients there, this might be of interest. So stay tuned. We will send more specific announcements regarding this particular refresher session. And this session will be led by another one of our infection prevention training liaisons, Lisa Ledoux. So stay tuned. Thank you again, everybody. Thanks for your participation. Appreciate your time today. Have a good rest of the afternoon.